Hello anatomy students. Today we're going to talk a little bit about the language of anatomy. This goes along with our unit overview of the human body. Alright, so first let's tackle anatomical position. A patient who is standing in anatomical position is standing facing you, feet together, and notice that the patient's hands are facing with their palms forward and their thumbs are out to the side. So usually when you are diagnosing a patient, they may not even be able to stand, they might be lying in bed, but this anatomical position is always the reference point, and so you should be able to imagine your patient standing in this position so that you can better evaluate their condition. One thing to remember about evaluating patients' conditions is that you're always going to use the patient's left and the patient's right for reference points. It's never you, the observer's left or right. It's always the patient's left or right. So if this guy was standing in front of me, then his right hand side would be here. That's his right hand, and his left hand would be on the opposite side. Alright, we call the front view of the body the anterior view, and there are a couple of different regions that you need to know that use the prefix ante, which means anterior or before, and here are a couple of them. Antecubital means the front of the elbow. That's where they're going to stick an IV if you need fluids or antibiotics or blood. And antebrachial, that's going to be the very front portion of the forearm. So like that really sensitive area here in the front. All right, if the patient turns around to have his back facing you, now this is called the posterior side. Now when you're looking at the back of a patient, you and he have the same right and left. So if I'm looking at the back of this patient, since he's flipped around, now this is the right and that's the left. Alright, our abdomens are pretty large cavities and they contain lots of different organs in there. And in order for clinicians to pinpoint where a patient could be experiencing trouble, they divide the abdomen into imaginary sections. And there could be 4 sections or there could be 9. The 4 sections are called the 4 abdominal pelvic quadrants. And if you take a look, you have a vertical line extending from the tip of the sternum down to the pubis bone of the pelvis, and you have one horizontal line running right through the navel. And since this patient is standing in front of me, his right side is there and his left side is here. And the quadrants, the 4 parts, quad 4, they're just named according to where they are. So the upper quadrant on the right is called the right upper quadrant. The left upper quadrant is opposite, right lower, and then left lower. And this is going to give clinicians kind of an idea of what organ is affected. So if a patient comes in and they're claiming pain in the right lower quadrant, well, since the clinician knows which body organs exist in the right lower quadrant, they're able to kind of start to think about what diagnostic tests need to be done. If something is happening in the right lower quadrant, the very first thing that's kind of screaming out is appendicitis. But if we want to get even more specific than the 4 quadrants, we can divide our abdominal cavity into 9 different sections. So notice that we have 2 vertical lines that are drawn just medial to the nipples, and our first horizontal line is drawn just inferior or just below the rib cage, and the second horizontal line is drawn just on top of or just superior to the pelvic bones. The resulting 9 squares are called the abdominal pelvic regions. And the names may look a little bit strange, but actually the names tell you exactly where they are. So let's take a look at the names along the very top row. We have the right hypochondriac region, the epigastric region, and the left hypochondriac region. Now, you've done a little bit of etymology on your medical terminology assignments, and you may know or you may remember that hypo means under. The root chond means cartilage. And then IAC means pertaining to. So this is pertaining to under the cartilage. And you're probably like, well, where's the cartilage that it's under? The rib cage. So the entire rib cage is not ossified. It's not fully made of all bones. Some of the bones are actually attached by cartilage, so especially at the bottom. So under the cartilage is an appropriate name. And then, of course, you have either the right side or the left side. The one in the middle, though, is a little bit different. Epi is a prefix that means above, and gastric means stomach. So the epigastric region is simply the region that is above the stomach. So you can see that knowing a little bit of etymology can kind of make your job of learning these different names a little bit easier. I think that the center region, the umbilical region, is probably the easiest because that's the region that contains the navel or the belly button, and that's where your umbilical cord attached you to the placenta in your mother's uterus while you were developing. So that's the umbilical region right in the center. On either side of the umbilical region, we have what's called the lumbar region, right and left, and this corresponds to the lumbar spine, which is a part of your vertebral column. So the lumbar region is on either side of the umbilical region. Hypogastric is the name that means below the stomach. It's also known as the pubic region because it is right above the pubic bone of the pelvis. So hypogastric / pubic region, they're going to be used synonymously. Now, the right inguinal region and the left inguinal region are named because of the inguinal canal that is found in males. This is the little hole that's made when, during development, the testes descend from inside the abdomen. They pop through that abdominal wall and they fall into the scrotum. And the resulting hole is called the inguinal canal. So this is the inguinal region. We have the right inguinal region and the left inguinal region. And so now you're able to really pinpoint if a patient is complaining of pain, or if an MRI picked up a mass somewhere, you're really able to determine in which region you can find it. And so, like I said, clinicians are going to know which organs are found in each region. So if a patient complains of pain in the left upper quadrant, it could be the stomach, the spleen, or the large and small intestine. So again, the quadrants are shown with the blue line here. And if we're talking about the left upper quadrant, this is the left side. And so stomach, spleen, large intestine, small intestine. And I suppose it could be possibly a portion of the liver, since the liver kind of extends a tiny little bit into there. Now, if a patient is complaining of pain in the left hypochondriac region, now this is one of the 9 squares, which are shown by the red lines. Again, here's our left side, and hypochondriac means under the cartilage. And so we are looking just here in this little space, and it could be either the stomach or the spleen, and that's it. So you can see how very specific you can get by using the 9 regions as opposed to using the abdominal quadrants. All right, so now we're going to start talking about anatomical directions. I got to move myself out of the way over here. So anatomical directions are going to allow clinicians to describe the placement of organs, even to describe the location of various irregularities, and they're also going to help the clinicians tell where incisions need to be made. And so, as I said before, the front is called the anterior view of the patient, but on humans, it's also called the ventral view. The posterior view of a patient also has a synonym. It's called the dorsal view. And you're probably like, okay, well, why is that? Well, here's why. I'm just going to draw a little picture of a quadruped. Let's just say a little cat, or I don't know, what does that look like? A reindeer? I don't know. So let me just draw this. Here is the legs and feet, and there is the body. Okay, so a quadruped is a creature that walks on all fours. And when we're looking at a dog or a cat or a mink or a mouse or something, the head portion is the anterior view. I'll put an A there for anterior, while the tail portion here is the posterior view. The part of the body that houses the spine is the dorsal side. Think dorsal fin on a shark. And the opposite to dorsal is ventral, which is the belly. Well, take a look at our human patient here. This is the front side, the anterior side, and where's her belly? Right here. So ventral and anterior are synonymous in bipeds, in humans. And if we were to turn her around, where her spine is, that's the dorsal side, but yeah, that's also the ventral side in humans. All right, I feel that proximal and distal is probably the most difficult to remember. You have to remember that when you're using these terms, you are referring to limbs only, so arms, legs, that's it. And the reference point is always where these limbs attach to the trunk. So on my patient, the trunk is right here inside of the green box. And your attachment points for the upper limbs or the arms are at the shoulders. Your attachment points for the lower limbs or the legs are here at the hip. So you're always referring to the closeness of the structure to the trunk. So my example here is that the shoulder is proximal to the wrist, and that should make sense. It means that the shoulder is closer to the trunk than the wrist. Perfect. We could flip that around, and we could say that the wrist is distal to the shoulder, which means that the wrist is more distant or further away from the trunk than the shoulder is. And so that's how you use proximal and distal. We could do the same thing like with the knee and the ankle. For instance, the knee is closer to the trunk than the ankle, so we would say the knee is proximal to the ankle, and we would say that the ankle is distal to the knee. Okay, so let's talk a little bit about sectional anatomy. When we do dissections, whenever you make a cut through an organ, you are making what's called a section. You're cutting along an imaginary line that's called a plane. And sectional anatomy is important to be familiar with, especially if you're planning on going into a career where you are required to look at MRIs, which are just digital slices of the body or of a certain organ. And what these slices allow you to do is to look for abnormalities that could be hiding like in between the layers of tissue. So I'm going to stop this video. We're going to call this part 1, and then I'll finish up these slides in part 2.